So there's this thing called Piriformis Syndrome, and the piriformis muscle is right here. It's this red thing, and it attaches relatively S2 to 4, in some people, and then it will pass through the greater sciatic foramen, so it'll be in the front of the sacrum, pass out to the back, and attach to the greater trochanter, basically the top part here. And because of this location, because this is where it attaches, and because of the fact that we have a big sciatic nerve underneath, we say that the piriformis muscle can compress that sciatic nerve. Notice the sciatic nerve here, it's made up of lumbar contributions, it's got some sacral contributions, and those all come together to make a nerve that goes all the way down the leg, basically giving motor, muscular action, and sensation to the area. And it splits off front and back of the true leg. And so it's a big nerve. It's a sizable nerve. Understand the point of that is it's a very large nerve. And so a muscle that happens to be running essentially right across it could generate a fair amount of force. Now, it would do so usually by compounding motions. So if I wanted to really tighten that piriformis muscle over top of the sacrum, maybe I could internally rotate the leg, the thigh, hip, however you want to say that, and then at the same time I could bring that forward into a big flexion, a hip flexion, a thigh flexion. Again, whatever you'd like to call that. Now we could do something, of course, to the sacroiliac joint too, whether you rotate it forwards, backwards. It really is just a matter of compounding those motions, because you could do the opposite of this, and just depending on how the person's put together, you could get the same effect. The effect being that if we increase the pressure here on the sciatic nerve, you'll feel pain as if it were coming from multiple locations, probably down the entire leg, because the body isn't always great at localizing it. And so in some people, in fact, this piriformis syndrome, their muscle, their piriformis, actually has two separate bands, one from the sacrum again in the front, and then one from the sacrum in the front passing behind the nerve, one in front and one behind. And so in theory, this really 10% of people that actually have this, yes, this could be a lot worse. But understand, saying all this, if you want to agree that the piriformis can do this to the sciatic nerve, a big and relatively well-protected nerve with a fair amount of fascia around it, that's saying something. That has more meaning than you probably think it does. Because if this arguably small muscle can do that, what could a larger muscle do in this same region? So let's look at a few examples. You've got a very large gluteus maximus attaching more proximally at the innominate and at the sacrum coccyx, making two bands and attaching at a distal point, really more at the greater trochanter, gluteal tuberosity, and IT band, just to be specific. Let me blur that out just a little bit for us. And so understand that, especially here at this bottom part, which is a relatively thick lower band of that gluteus maximus muscle, that sacrum hip point where the sciatic nerve actually passes, right about here, is right where the gluteus maximus passes. And on a harsh contraction, again, some kind of a compounding motion where we might see, let's say, extension, which is a glute max thing, with some external rotation, we could generate a lot of force in this area. So if you want to say that the piriformis muscle can generate this pressure to stimulate and irritate the sciatic nerve, how could the gluteus maximus not do a very similar thing? It doesn't seem reasonable that one can and the other can't. Looking at this more from a side shot, so this is a side shot, there's sacrum, pelvis, and then this is a sciatic nerve just running down here. The gluteus maximus essentially attaches here and comes down and attaches into here. So it's a bit of a messy drawing, maybe on purpose, but big, sizable muscle covering a fair amount of that. And we have the potential for pressurization of that nerve. And that means, again, the body's going to think that nerve is being irritated and send painful signals. It doesn't always know exactly where it's coming from, and that's okay. That's just kind of what it does. But we have a location and a probability for that. Let's throw up another one, though. We've got some pretty big muscles that we call the hamstrings. So say, for instance, we take the biceps femoris muscle, which has two relatively large contributions. We can do better than that. There we go. We'll throw it in like that. There's our biceps femoris muscle of the hamstrings. And then we've got our semitendinosus, semimembranosus, just represented as one line here. And they cover up a fair amount of that sciatic nerve. It's not an exposed nerve in the back. Otherwise, you'd really feel it every time someone poked you in the back of the leg. It would be like, kind of a funny bone feeling every time someone touched the back of your leg. And so we know for sure those muscles cover and obscure the nerve. And they contract really, really hard as well. They're not light in their contraction. So as these muscles contract, say in a harsh, again, I mean, we can make a number of different examples as you internally, externally rotate that leg, along with extension of that leg, like so, give or take. There we go. Extension of the leg. It creates quite a bit of pressure within this region, and not every step, of course. I'm not saying that every single step is going to compress the nerve in a way that it hurts. In fact, very few likely are. But there's a potential that this piriformis exerts less power, less force than these hamstring muscles would. And remember that sciatic nerve is actually right pushed up against bone in this case. So it's muscle, bone, nerve. There's going to be a winner if they fight. So again, looking at this is it from the side now. So if we have our biceps femoris muscle attaching essentially there, and we have our semitendinosus, semimembranosus. The sciatic nerve is in this location. As those tighten up, looking at it from the side, they can compress that way. Again, more than enough force generated in here to be equivalent to, maybe not as much of a pinch point, but equivalent to what the piriformis does here. Just looking at a cross-sectional view, so this is a cut of the thigh, that sciatic nerve would really be about here in this location. These muscles shift around a bit as they change size and shape, but it is at a point where we can put a heck of a lot of pressure on that nerve based on harsh contractions and based on pre-tensing, pre-lengthening them as we move and shift our body around. One more example. So we've got as well a gastrocnemius muscle. Gastrocs going condyles all the way into the, there we go, calcaneus. And big, bulky muscles here in this case, very sizable. So again, they generate a lot of force. Consider for a second that those gastroc muscles can basically move your entire body weight around on a contraction. When you do a push off with your foot, it's very easy to push off just from the ball of your foot, just from that part right there. And so that means the force that they can exert is quite significant. They can compress for sure this way, and they can press back against the nerve as they tighten up. Again, a different look, a different angle, a different push on that nerve. So from the side here, just one more time, there's the gastrocs, and we'll throw in the soleus just for fun. There's soleus right there, and the nerve is at a point, it actually goes through the soleus. It is at a point where a lot of pressure can be exerted when we're contracting that gastroc, because it's very capable of tightening up, cinching up to the leg. And again, we have a situation where as we look at it in the cross-section, at a certain point, not to overcomplicate a thing, but at a certain point, the nerve starts out here, then it actually passes through soleus into this location. It is sandwiched in between layers of muscle and fascia, which are constantly changing tension as you walk. So what does this all mean? It doesn't negate anything. It doesn't negate the idea that the piriformis can cause a problem for the sciatic nerve. It can cause a problem for the person using that sciatic nerve and using that leg. But to be as thorough as we possibly can, we have to consider all of the other things that cover that leg, all of the other muscles and all of the other fascias in particular that change the pressure, change the mobility of that nerve, and change its ability to properly transmit signals through the area. Yeah, it's Simple Lines Anatomy. Come hang out sometime. You like burgers?